In video 4, we discuss how to manage weight gain and gastrointestinal side effects from lithium. Weight gain is a big issue. I would start out by saying, though, that head-to-head studies have shown there's more weight gain with lithium competitors in treating mania, including valproic acid, olanzapine, and quetiapine. All of those cause more weight gain than lithium. And I see that clinicians often don't stress that adequately, especially with valproate. So lithium is actually better than those. And we can manage at least some of the causes of weight gain with lithium moderately easily. So that's one of the key points of this talk. So there are 4 causes, apparently, at least 4 that I could name for you, of the weight gain from lithium. One of them is a consequence of the increased thirst that they have associated with eating all this salt. That is what's involved with taking lithium. Lithium being a salt, very similar in many ways to sodium chloride. And consuming caloric beverages is a great way to gain weight on lithium. So if you are doubling or tripling your Pepsi or Coke ingestion on lithium, for sure you're going to gain weight. I'm sure you're all aware of these recent studies that show that the calories that you get from beverages don't reduce the calories that you subsequently want to have from your solid meal. So you're not less hungry and will not eat less of your regular meal because you just consumed 1,000 or 2,000 calories in your beverage. But yet those calories are in there and ready to do their damage. Patients need to understand that as a general principle and specifically as it applies to the thirst they're going to get from lithium. Now, those diet beverages aren't necessarily any better, though. The Diet Cokes and the Diet Pepsis, I'm sure you've been reading the issues with those. All those artificial sweeteners in them only contribute to increasing your desire to have sweet substances and do not actually produce weight loss when utilized, as best we can tell. You'll make up those calories in other ways. So really, water and beverages that have solutes, although not carbohydrates, are what they should be consuming. So this may require some lifestyle change and moving away from their favorite beverages, but this discussion needs to be had. Second issue with weight gain is water retention. As you can imagine, eating salt causes you to retain more water in the body. And this is one of the causes of very rapid weight gain. Someone has gained 10, 20, 30 pounds in a week or two, and they feel bloated. They can feel liquid sloshing around in their abdominal area, or they may even get some puffiness in their limbs. This is water weight that's been put on, not adipose. And the treatment for this is, there is a treatment for it, and it could be the use of a diuretic. The recommended diuretic is amiloride, which we discussed earlier, 5 or 10 milligrams. Start with 5. This is a potassium-sparing diuretic, usually does not raise lithium levels, though occasionally it does, so you do need to recheck the lithium levels after trying it. The more commonly prescribed thiazide diuretics, like hydrochlorothiazide, also will treat this problem in doses of like 12.5 to 25 milligrams. But the thiazide diuretics do raise lithium levels sharply in many patients. They're not contraindicated, but it makes it quite tricky to maintain good levels. You can monitor it, the levels, after using hydrochlorothiazide and make lithium dose adjustments. But amiloride is the less often used but perhaps easier way to deal with this problem. The third cause is slowed metabolism. And we already discussed that in the last video. Hypothyroidism slows your metabolism and you can gradually gain weight. Now, presumably you are monitoring thyroid function. You're keeping that TSH even at 2 or less, if you're following the latest thoughts on this issue, and thereby not allowing even subclinical hypothyroidism to start to develop where there could be some slowed metabolism. But this is a more long-term effect, not something you're going to see weight piling on soon from this cause. And finally, the fourth is carbohydrate craving. And this is perhaps the toughest contributing cause for weight gain with lithium. Many of our medications cause this, as I'm sure you know, including the 3 competitors, quetiapine, olanzapine, valproate, all are associated with this carbohydrate craving. I'm sure you've heard about the famous so-called Seroquel munchies. I learned that term from some of my veterans who told me, I first heard about it from them, that 30 minutes after taking a 50 milligram quetiapine for bed, they had this massive craving for something sweet. And they would head for the kitchen and have a peanut butter and jelly sandwich, maybe a second peanut butter and jelly sandwich, and only then were they able to get back into bed. The weight gain, by the way, on quetiapine, as an aside, is not dose-related. You can get it on very low doses, perhaps due to this Seroquel munchies issue. But anyway, back to lithium. Lithium can cause it as well. A point I always make with patients in describing the drug, pointing out that it's not manufactured, it is found in nature, it's in salt mines, seawater, even some extent in drinking water. And for those who prefer naturally occurring treatments for themselves, that can be a bit of an eye-opener for some of them and help them agree to take it. But anyway, it is like salt and makes you thirsty. And patients should be prepared for this. Don't let it sneak up on them. And after they've gained 30 or 40 pounds, you say, oh yeah, now they're eating all these candy bars. And you say, yeah, lithium could cause that. They should be prepared for day one for noticing that there might be an increased craving for sweets. And they should have a strategy plan for how they're going to deal with that. Whatever their favorite or perhaps possibly satisfying non-sweet snacks that they could take, whether it's low-calorie popcorn or celery sticks or carrot sticks, try to identify what their plan is going to be if they get this problem. So this is what you need to do with the weight gain. You have to discuss it openly, discuss the various causes, tell them that you have solutions for these causes, and that is how you deal with the weight gain issue with lithium. Next, I'm going to talk a little about the gastrointestinal side effects, also a moderately common cause for discontinuation. And that is, first of all, the nausea, which occasionally can be more severe with actual vomiting and abdominal pain. So what can one do about that? Well, taking it with food has been proposed as helpful. That's certainly worth trying. I already mentioned in an earlier video that the capsules are always really to be preferred over the tablets. The tablets have a salty taste, which is nausea-inducing for many people. The capsules enable you to avoid that. And the third thing is, here's a situation where you may have to consider the long-acting preparations. They used to be called Lithobid when it was a brand product. It's now generic and called Sustained Action, or SA, version of lithium, 24-hour lithium. It's really not much more long-acting than the immediate release, which, as I've mentioned, itself has a 24-hour half-life, not exactly short. So it's a little longer with the longer acting, but they are also absorbed a little more distally. This is the process of how it might work. It goes on past the stomach, and some of it gets absorbed there, where it may cause less nausea and the more extreme vomiting and abdominal pain. So those are your options for managing that. Now, what about diarrhea, the other end of the gastrointestinal? Now, this is presumed due to more distal GI irritation. So what can one do for the diarrhea? Well, you, again, would prefer the immediate release formulation if you aren't already using that. You should certainly switch to it. That's absorbed more proximally, and it may improve the diarrhea. Symptomatic treatment with Loperamide has been suggested. There are no studies on how long to prescribe this. It seems reasonable at least to use it for weeks, and that may enable you to continue and possibly get this lithium trial completed. But certainly if someone's having continuous diarrhea and they're getting anal rashes and they're very uncomfortable constantly in the bathroom, this could be one of the things that will enable you to not be able to use lithium, unfortunately. And there's one other possible usage of lithium that could solve this problem. There is a preparation of lithium that is absorbed just about 100% in the stomach, and that is lithium citrate, the liquid version of lithium. It comes in a rather nasty-tasting cherry-flavored liquid. I forget the dose. I'd have to look it up. But I think a teaspoon is the equivalent of 300 milligrams, and they should certainly wash it down with some water as soon as possible. But it is absorbed quickly in the stomach. So if diarrhea is the problem, this might enable you to get around it. And this is recommended, by the way, in that lithium encyclopedia from 1987 from Jesserson and colleagues that I mentioned in an earlier video that I'm thinking you should all try to get on your shelf. So in summary of this video, the key points. Weight gain is common on lithium, but less than with the other common options in treating mania, such as valproate, olanzapine, and quetiapine. Discuss your plan for how to anticipate and manage any possible weight gain from lithium in advance. Don't wait for the weight gain to happen and then propose plans. Get the patient on board with the fact that you're serious about wanting to prevent this problem and sympathetic, and that you have some answers. And then be prepared to repeat those discussions, because one very evidence-based statement I can make from the science of medicine is that patients will not remember things you've told them. You will have to repeat them on subsequent visits. This has been shown throughout medicine, not limited to psychiatry by any means. Don't assume that because you've told somebody something that they're going to remember it. If it's important, you will need to probably repeat it, maybe multiple times. That's a very evidence-based claim I'm making right there. Next key point, there are at least 4 ways to gain weight, and we discussed in this video the ways of dealing with those. Water retention, often with polyuria and other symptoms of the diabetes insipidus-like syndrome that lithium can give. Water retention can be managed with a diuretic. They need to avoid drinking caloric beverages. They need strategies for dealing with carbohydrate craving if it pops up. And with long-term use, hypothyroidism could occur and needs management with levothyroxine. And the other key point had to do with issues of gastrointestinal side effects and how nausea, vomiting, and diarrhea can end lithium trials. Be ready right away with management options to try, like offering different lithium preparations or symptomatic treatment such as with Loperamide for diarrhea.